So, welcome back to our next session. And the speaker this afternoon, I have personally known for, I worked it out at lunchtime, 16 years. He's lived with kidney disease since the age of 4. Recently he's had his second transplant following 5 years on dialysis. He's here to share his challenges, his triumphs of navigating treatment, university, and also being a young man in a renal world. It's my pleasure to welcome Alex Gibbs.
Do I have my slides? Are they on? Fancy, I do have slides. He's stolen all my content. He's introduced me for me, but I'm still going to do what I wanted to say anyway, which is, hello, I'm Alex Gibbs. I'm a second-year medical student at the medical school in Norwich. I wondered if I could talk to you a little bit today about your condition and what's brought you into the hospital. Would that be all right? Great. Could I confirm your name and date of birth, please? I'm sure many patients in the room will have been of great use to my colleagues and fellow training doctors to share with you and to share with them the experiences of kidney disease. And I'm very proud to be a medical student at the moment, being in the hospital, talking to patients that are fellow to myself and fellow to you guys. But I feel like the way we introduce ourselves is not that usually. It's in a different way, which is when we go up and we say, hello, I'm Alex Gibbs, I'm here for transplant clinic. And they go, date of birth, yes, 181102. Hospital number, yeah, I've got that one, 222-1702. And then they go, no, we can't find you. And then you have to give you an NHS number. And you go, yes, 701-321-3594. And then they finally find you in a system. And then they take a look at me and they go, that's a lot of medical records for a young man. And I go, oh, yes, I do my best. So I'm not trying to win, but I seem to keep winning. But I want to talk a little bit about my experiences. And this is a word behind me, resilience. It's a word that I have come into claiming as something that I have. And I think everybody can claim it as well. If you're a patient, especially a kidney patient, by nature of still being here, you are resilient. Because it doesn't matter how much you've gone through. It doesn't matter if you're a carer or if you're a family member. To go through what we go through, you gain resilience by doing it. And so I do lay claim to that, and I want to talk a little bit about why I think I can lay claim to that word through my experiences. So, as Pete said, I got ill at 4, and I had a transplant when I was 10. I'm just going to ignore those 6 years. I don't think they're relevant today. I lost my transplant when I was 17, and it's those 5 years from then to now that I'd like to talk about today. So, I lost my kidney for rejection, but that was also right at the outbreak of COVID, which is not very good timing. So I was meant to be going through transition, moving from pediatric to adult care, and I had a routine set of bloods, and those came back with my creatinine being at 666, and if that isn't a bad omen, I don't know what is. So I was called into A&E in my local hospital, and I seemed all right, and they checked me in, and they asked these questions. We're in about March 2020. And they said, have you been abroad recently? I said, yeah. I just came back from northern Italy on a ski trip. And if you cast your mind back, that's given a red flag to a lot of people in a hospital. So I did manage to, in about 6 hours, lock down an entire A&E department. They had to vacate everybody. I was the first, query of a COVID case. I didn't have COVID at all, but they had to do their thing. And 2 weeks later, it was a completely different picture. So I was admitted as an adult from the emergency department where I'm from in Peterborough, and they didn't really know what to do with me. They said, well, we need to have a look at your kidney, so we need to do a biopsy. They offered me that biopsy in 10 days. I said, that's not particularly impressive for the way the numbers are. I asked them to contact my pediatric unit. They did. They could do it the next day. So I went straight back to my pediatric unit, had a biopsy the next day, and started that run and rejection. But for me, in Peterborough, I'd come here in Nottingham for my pediatric care. And as we talk about, at the start of COVID, I was completely on my own for the first time in hospital. I was 17 years old. Picture on here, that's how I was keeping in contact, on Teams, because nobody could come and visit me. And again, as you know, as a patient, things come at you fast and you've got to make decisions at the time. and I was faced with my first big decisions about what care I wanted and how I wanted to progress. I was offered a strong immunosuppressant, and we're at the start of a pandemic and nobody knew how that was going to affect people, especially not young people, especially not kidney patients. There was no information, so it was, have this immunosuppression, ATG, wipe out your immune system for a while, but we're in a pandemic, what do you want to do? I went for it. It didn't work very well, but I was quite proud to have made that decision. I do stand by thinking it was the right one. So I started dialysis. A couple of months later, I started PD. I don't think I look very well in that picture. You can see a PD tube. It wasn't too bad because, it was COVID, so you weren't really doing much. But there you go. Yeah, started on PD. But eventually, I had to move on from pediatrics, which was very sad. I'd known them all my life, so I had to come into adults. But that wasn't done properly. It's meant to be a thing when you're a young patient, you have a transition, and you meet the team over a time, and you learn them, and they learn about you, and it's a kind of smooth process. I didn't do that. I was back in A&E with a blood pressure of 230, 180, because my PD wasn't working very well. As we spoke about earlier in other presentations, I had that decline in renal function, and the PD wasn't working. So I rocked up, again, didn't know anybody there, they didn't know me, and suddenly they're taking over my care, sorting out my PD, trying to get me a bit better. The new nurses were nice, but it was the first time I'd ever been admitted to an adult ward, and it was terrifying, if I'm honest. I was 18, and you grow quite used to the crying babies, but you don't have crying babies, you have a lot of different sort of crying. It's a new world. At least my mum could come and say hello. So, yes. I did do all my own PD, that was fun, but again, with that worsening decline, I ended up doing it for a long time, a day, and took a lot of impact on my school. I didn't do very well at school, but again, luckily with COVID, I kind of got a free ride, which I'm quite grateful for. And during that time, I did secure my spot at medical school. It took quite a few years to get there, and I'll come back to that as I go. There are a few hiccups. And the first hiccup was a bad clinic. So this was one of the first clinics I had after that admission and change over to adult care. If we set the stage, I have this worsening kidney function in the background. I'm on PD, but it isn't necessarily working very well, and my bloods aren't looking great. So I come into this clinic, and I'm completely on my own, because with COVID, you can't have people go into the hospital. So there's me, a new doctor who I've never met before, and the PD nurse that I met once during my admission who sorted me out. I remember this clinic so well because this doctor, he was right, but he didn't speak to me correctly. He sat me down and he told me, "You will be dead in 6 months." And that's not something an 18-year-old on his own wants to hear the first time he's met a doctor before he's really introduced himself or got to know anything about him. So his point of view, he wanted to get me off PD, get me onto hemo, get me on better care. But when he came at it with such attitude, it just terrified me. And I kind of fought back against it. And I said, well, let's test it more. Let's change the PD. I was still hopeful for a transplant. And the prospect of hemo as an adult with a fistula terrified me. And I was resistant to that. As I'll come back to in a minute. If he'd gone about it differently, it might have been a very different story to me. But it terrified me. He didn't know me well enough to talk about that. We did stabilize it a little bit, and as I said, at this point it was 14 hours of PD a day, which is not a great way to live life. I was deferred from my place at university, so I was just doing PD, and that was it. There was the hope of the transplant, and I had a transplant lined up, and my mum was going to donate to me directly. So that was the kind of position I found myself in when I come to the next hurdle. So my PD's kind of okay, but we're just about holding on for a transplant that I've got lined up with my mum. It's the start of 2022, and I start getting new pain, new symptoms, and at the same time, I'm noticing that I'm stopping peeing. Like that's stopping. So I go in to talk to a doctor, and I say, I think something's wrong. I think that kidney that's rejected, I think there's a problem with it. We need to check it out, because I've got the transplant lined up soon, I don't want anything to come in. I spoke to a lovely registrar, and he kind of believed in what I was saying, and he wanted to get it checked out and wanted to get me sent over to Adam Brooks, my transplant unit, and see what they could do. But he had to clear it with his consultant first, and so the consultant comes in the room, he takes a look at me, doesn't think there's much going on. He pulls up a X-ray from 6 months previously and tells me I've got like a deferred pain compressing on a nerve in my spine, which is complete bull, if I'm being honest. I wasn't very happy. Mum wasn't very happy. And then we went for our pre-op, hoping it would just kind of not be a problem. But for this transplant, they said we were no longer a direct match because my antibody levels had changed. So it was bad news on top of I'm not very happy about this problem going on. And I was in a lot of pain one day. A couple of weeks later, we went to Adam Brooks A&E because Mum refused to take me to Peterborough after this doctor had said these things about compressed spinal nerves and stuff. We went there. They took a look at the bloods they'd done 2 weeks before, my presentation, the history of it. And they said, yeah, your kidney's bad. They admitted me, and then a doctor came around the next morning, a surgeon, I should say, and he was great. And he said, we'll take your kidney out tomorrow. So I'd gone into A&E. I didn't think there was going to be that much going on, but he wanted to take my kidney out. So I did have this surgery. After the fact, when we look back, it might have been life-saving. I don't know. It definitely changed my life a lot for the better. It's my favorite surgery, but it's also probably the worst one I've had from a patient point of view. So, no, I've gone one too far. We'll stay there, never mind. Yes, so I had this kidney taken out, and this doctor says, we've got to take the kidney, we want to switch you from PD to HD. I think he thought I wanted to stay on PD. At this point, I didn't, because the transplant prospect was gone, and I felt so terrible. I wanted to be on HD anyway. So I switched over to HD. But he came back 5 minutes after this ward round, and he said, do you want a fistula? I said, yeah, great. So I went in next morning, 8 a.m., and I had a PD line out and all of that sorted, a hemo line put in, a kidney out, and a fistula in. And like 4 surgeries in one, that makes me very happy. That's very efficient. I wasn't very well afterwards, but it's fine, sort it out. So that's the point. We've done my titles, lows and highs of dialysis. So there we go, that's the lows. Went to the transplant games. She's got a laugh. Yeah. Woo. Thank you. There's transplant games over there, that's fine. So had a great time. Everything's looking up. Started playing badminton again, which is my sport. We'll come back to that. There's more good news later. So at this point, I was feeling good. I wanted to go to uni. Had a cardiac arrest on dialysis. I was 19 at the time. It was completely unprovoked, completely unexpected. I remember waking up from it. I don't remember it happening, but I remember waking up. I thought I'd just been having a nap on dialysis, but there was about 13 people around my bed, and they all looked very, very concerned. And then my chest started hurting, and I'd broken a few ribs with some CPR. And as I kind of came round and started realizing what was happening, looking back, it was the most terrifying day or two of my life because I couldn't remember a thing. I knew my name was Gibbs, and I remember looking up, and I knew the name of the doctor who was looking quite happy that I'd woken up. But I couldn't remember a thing. I had a spot at medical school, and I thought that was over because I didn't know anything, I couldn't remember anything. And that kind of messed me up for a while. So I took another year, and that was kind of my mental recovery. My physical recovery, not so complicated, but after the cardiac arrest, when I got home, I had a massive panic attack, thinking that it was kind of happening to me again. And then when I got back on dialysis as an outpatient, I kind of having recurrent episodes of this panic, thinking that every time I felt a little bit unwell on dialysis, I was just going to spark out again. So it did take a year, and I told my team about this, and maybe this is a benefit of being young, but they took it very seriously, and they got me some really good help. And I engaged with a clinical psychologist, and I got a lot better. And I'm proud to have come through that. It was a rough year, but I did get there. And I got up to a few good bits. So my sister got married. That was quite fun. Got to walk her down the aisle. Of course, I'm going to go to the BTG. I'm always going to go to the games. If there's games, I'm going. Simple as. And I took my first ever holiday while on hemo in the kind of August before I was going to uni in September. And on the way back, I decided to have a 12-hour nosebleed. So I had to pop into it. Like, my sister was getting some of the family highlights, so I had to cause a bit of drama, just get a bit of notice before I then left to go to uni. And uni is absolutely the best thing that I've ever done with my life. It was scary to go at the start. I'm on dialysis. I'm going to a new place with a new team, with new nurses trying to access my fistula, which has always been a bit of a terrifying thing for me. But it was fabulous. The team I had in Norwich, where I study, were just excellent from day one. They spoke to me so much about how to fit the dialysis around my studies. We had a session earlier about what can you do on dialysis, and I did work on dialysis at least twice. I was there for a year. I did at least 6 hours of work. There was a lot of Netflix otherwise. But I planned the work in, and then I was like, if I've got to have 4 hours a night sat doing nothing, I may as well have that as the fun time. I don't know, I did a lot of NHS e-learning. You have to do all these modules where you fill out a form online. Oh, that was a good spend of dialysis time. Because it's quite nice. If you're at dialysis, you're surrounded by nurses, and they've all worked for years, and they all know what they're doing, so you can just ask them all the questions. So I made good use of my dialysis time in Norwich. So I was happy about that. At university, of course, you have clubs and societies, and I got back into my badminton and loved it, loved the club, loved the people. Went and competed at a transplant sport event. I won it, and I won the Cliff Lavin Trophy, which is awarded to those who, despite great adversity, strive for excellence, or something like that. And I was, I'm very proud to have that. It's still in my bedroom as well, because they haven't run another badminton event, so I get to keep it. Another thing to mention with coming to uni, I decided to take a year off from the transplant list. I'd already deferred my place twice, and I didn't want to have to then take an interruption in that first year to have a transplant. As much as a transplant's a great thing, I decided it was my priority that year that I wanted to do a year of studies. And I did, and I passed, and then we had to start talking about transplant options again. So to talk about transplant options, there was a few things that had to be considered. I wasn't completely suitable, but before we talk about my insuitability, I went to the games again, of course. I love the games. Caught up with Stephen Emerson, I'm sure we know in this room. Love that guy. He's our peer supporter lead. So I had to throw in a picture of him. Again, on dialysis, whenever you go to these things these days, trying to organise that with clinics around the country, difficult, but doable. I definitely didn't have enough dialysis. I should have booked 2. I only booked 1. I wasn't very well. You're allowed once every now and then. But 2 weeks, no, 10 days. 10 days after I got home from the games, I had my parathyroidectomy, which I'm sure people will be familiar with. If you've had chronic kidney disease for a long time and you've been on dialysis for a long time, you can get problems with parathyroid glands in your neck that deal with calcium and a load of other bone-boring stuff, who cares. They had to cut that out. They wouldn't let me have a transplant until that was done. So I asked if they could do it in Norwich, and they said, yeah, we put you on a waiting list. It's about 18 months at the moment. I wanted a transplant pretty sooner than 18 months, considering this was last August. So I called Adam Brooks, and they said, yeah, we'll do it in like 2 months. So I went with that option. Norwich were a bit salty. They weren't very happy with me, but I got the surgery done, and it was done excellently. Yeah, the scar is like perfect. You can't see it, But the surgeon who did it, he gave himself a 6 out of 10, which he found me. I was leaving the hospital, and he just found me in the foyer. And it's just like, let me look at your neck. I was, pretty normal moment for the prof, but that was fun. I also always found whenever you're in hospital as a kid, like they try to wash your hair, and it's horrible. I didn't like it, so I cut it all off. I'd recommend. It's good, especially if you're having stuff like on the neck and you can't shower. So that was quite fun. Afterwards, I got a bit of hungry bone syndrome, which is a completely legitimate medical term, and it is my favorite medical term, because that is just what it's called. They give you calcium for ages, but I spoke to the transplant team and the team in Norwich, and they were happy to put me back on the transplant list at this point. So I didn't want to go for deceased. I wanted to go for the matching scheme in the paired scheme, and we discussed that earlier today. So I was back on the paired scheme with my mum. She couldn't donate directly from a few years ago, but she was still happy to donate. So we went on that. We'd been on a few others, and there was some problems. When I had the arrest, that took me off a match that I had. But we put it back in for the October run, I think it is. And we got a match first time, straight after that surgery. And that brings us to the run-in. So with that match secured, I had to inform university, and they were excellent. They fully understood everything. They let me take the 2 weeks off I needed to isolate. They've let me repeat the same year I'm in this year, so I'm redoing the second. And those months were quite fun, because the medicine was not too much, and I kind of knew I was having this transplant. I put a lot of hope in it, which was, maybe not the right idea, but it did go ahead excellently. So I celebrated my 5th year of Christmases on dialysis, but they let me off for Christmas Day, I'm sure as you know, as a hemo unit, so that's Christmas Eve. But yeah, I miss the team in Norwich a bit, as I'm sure you come to realise when you leave dialysis, if you had a good experience, those people, you see them for so much of your life, and they become such a pivotal part of what you do every day. They were good people. It was nice. But yeah, we got done. I don't know where that's come from, but there you go. So that's my mum, day one, and that's myself, day one, after a successful transplant. And recovery was quite good. 7 days in hospital, which is not the best in the room. Still salty. But yeah, we went home. All been pretty good so far. So what do you do with your life post-transplant? As much as possible is what I try to do. I was elected president of the badminton club, and I spend half my life doing that these days. Straight back into my studies. I'm on placement tomorrow, back in the hospital, so got to get back for that. And yeah, my daughter had her second kid, got to meet her, that was cool. And I think the highlight so far, and a highlight that I will always look back on in my life, is completing the donor run with mum, side by side the whole way, 5 months after surgery, where she gave me my life back with a transplant. So yeah, more to come. Thank you very much. I don't know. Ladies and gentlemen, Alex.